So here's your first installment of your seated workout. So this is to help strengthen your trunk or your core, and also to help create more stability and to open up your shoulders and your chest so that we can kind of combat this rounding that's happening in the upper body, so in that kyphotic curve in your upper back. So as you sit nice and tall, you'll just come to a chair. Make sure that you've got, first, before we get started, make sure you've got a ball. You can get these at the dollar store usually, at the Walmart, whatever. So just some type of a little play ball was fine. Just make sure it's not too firm. You'll want something that you can squeeze between your inner thighs. Here, give you a little resistance. And then we're going to have a band, so a resistance band that you could tie easily around your thighs. So let's have that. If you don't have a ball, find something very firm that you can squeeze. All right, so like a really, really firm blanket, or that you could roll up maybe, or not a firm blanket, a firm pillow, or a blanket that you can roll up to give you some resistance to push into. Okay, so have those available and just sitting off to the side somewhere. So as we come to seated, you might kind of move forward toward the edge of your seat. Make sure your feet are flat on the floor. If you need to elevate the floor to you, go ahead, grab maybe some books or something that you could stack underneath your feet. So we want the feet flat, but pretty much any standard chair or bench that you could sit on and come to the edge of should be fine. So as you're seated tall, shoulders roll back. Take a deep breath in. Exhale it out. I want you to connect that exhale with the space right here in your belly. See if you can pull the space in as you exhale out. Just blow it out. Okay, so as you continue to breathe, I'm going to give you a few cues here. So I want you to pull in and up. What does that mean? It's like you got to go to the bathroom, but you got to hold it. All right, so those are your deep core muscles. The pelvic floor muscle lifting in and up. And then if you have this pelvic belly space between hip point, your belly button, and your pubic bone. We'll talk about the pubic bone a lot as we practice. Okay, so noticing where your hip points and your pubic bone are. This space here, you're going to pull in. Okay, so let's take another breath. Try to get the breath into this mid space instead of your chest. Exhale it out. So you're pulling your belly in as you're exhaling out. So let's take one more. Now moving slowly through the spine, you'll inhale, bring the heart forward, shoulders roll back. You'll get a little slight lift of your tail behind you. Exhale, rounding out. I want you to pull the belly in deep again, like you were scooping in and hollowing it out. Okay, so I'm going to turn sideways so you can see that better. Inhale, lift up. So notice here, kind of arching just a little bit, pulling back the shoulders. So pull back your shoulder blades. And then exhale. Take a little rounding, but not too much in your upper back. That's where we're already rounded out. So I want you to scoop here. Inhale, float it up, and exhale, roll it back. So I want you to start to feel these muscles here engaging. Inhale, you're not just moving, just kind of moving forward and back, you're really engaging. So pull in, like somebody was going to sucker punch you in the belly, and you have to brace yourself. Okay, let's take one more. Inhale. So we'll refer to these movements as cat and cow. All right, so as we lift forward, we call this cow. Think of kind of like a sway back cow, cow-like figure. And then exhale, rounding, pulling back. It's like a cat, a howling cat, kind of rounding and arching his back. So it's cat and cow, seated. So then we'll pause here. Shoulders are staying pulled back. So I want you to take a moment just to pull your shoulders forward a little and then pull them back. Okay, so again, you're going to just pull them forward a little bit and then roll them back. Okay, so inhale, pull them forward, and exhale, roll them back. So let's take just a few more here. You might even have your arms by your sides, like you were just going to kind of gently pull them forward, and then a little bit of lift and pull back. So then we're going to always try to keep them anchored back. Let's do a few shoulder rolls all the way around in a circle, just to the back of your body. So you're not rolling forward, you're rolling to the back. So I want you to feel these muscles in your upper back working and engaging. Take another breath. We're going to try to keep those shoulders pulled back most of the time. So just rest your hands by your side. You might even hold on to the edge of your seat, okay, just to keep you a little bit anchored and stable. So now I want you to find that pelvic belly space again. So belly pulls in just a little bit. We're going to pull up deep inside, again, like you have to go to the bathroom, but you're going to hold it. So you're pulling up deep into pelvic floor space. You may not connect with it right away, but you'll get better at it as you continue to practice. Okay, so this is all engaged. We're going to slowly, without leaning back, start to float your left foot off the floor and then lower it back down. So it's just maybe 4 or 5 inches. Again, sit up really tall. Pull the belly space in. We'll call this pelvic belly, this space down here. And lift and lower down. So we're not trying to create any tension in our low back. If you really need to take a little bit of support back here, if you can scoot all the way back and let your back press into the chair with your feet still on the floor. Mine don't do that. So you might have to put something under them or put a pillow behind you. All right, but I don't want you to rely on that. I still want you to lift. So you're going to float up and float down. Okay, inhale. Pull the belly in. Exhale. So you're always engaging. This is supporting you. Take another one. Inhale up and exhale down. Again, inhale. Every time I want you to put intention into your core before you lift your leg. Let's take it 2 more times on each side. Inhale. Let your shoulders stay relaxed. Again, your hands can be holding on or just beside you. Lift the heart as you lift your leg. You might feel a little tension there in the front of your hips. That's okay as long as there's not sharp pain. And now release. Okay. So again, we're going to bring hands to thighs. Let's move through that cat-cow again just to loosen up the spine. Just nice and fluid. Inhale. Exhale back. Let's take one more. All right, now we're coming back to center. We're going to add some coordination with that leg lift. All right, so shoulders back, loop them back again. Pull up into that pelvic belly space. So if your pubic bone, the hard spot of your bony place right here at the pubic space right there at the top. So if you find that space in your belly button and then you try to pull in between those 2 points. Pull in. All right, so shoulders are back, heart lifted, pelvic belly engaged. We're going to float the left foot up and your right arm, just to shoulder height. Bring it down. Inhale, switch. See if you can float them both up and lower down. Inhale, lift. So I want you to keep your heart lifted tall as you take this movement. We're going to take just a few more. Inhale. Exhale it out. 4 more. Inhale. Exhale. 3. 2. Remember to engage. Don't lose the engagement. And 1. And release. So I want you to slide yourself all the way back into your chair now. Okay, so find the back of your chair with your upper back. Pull the belly in. So it depends on if your chair is kind of rounded inward like mine is. Not trying to press my low back into it right now because it's going to push my pelvis back. Okay, or it's going to tip my pelvis. So I want to keep this neutral, right? So there's always a little small curve in your low back. That's a normal curve, right? If you needed to place a little small rolled up hand towel or something right into that curvature, so right here into this lumbar, that might give you a little more support. That's okay. You could take that as well and then come back. All right, so here we are. We're going to take the arms, reach them forward, and then open up, pull back like you're going to squeeze your shoulder blades together, but try not to overarch in that back. So just that little small space behind your low back. And now bring it back to center. Inhale, open up. Pull back open the chest and exhale. Bring it back to center. So I want you to feel your upper back muscles pulling together like you're going to squeeze your shoulder blades. You might think of it like you were going to try to pinch or hold a walnut between your shoulder blades as you move your arms back. So not just your arms moving, but your shoulder blades moving in towards center, engaging all these posterior muscles, the muscles that help you contract and hold your head up to support yourself in your posture. All right, so inhale. I want you to also make sure your head is pulled back a little bit as though that chair was tall enough that you could push your head into the back of the chair as well. So 3 more. Inhale, open. Check back in. Is your pelvic belly engaged? Okay, it's supporting you. Let's take 2 more after this one. Inhale. Exhale, open. And let's take the last one. And then release. So the shoulder, top of your shoulder, maybe even kind of firing up and talking to you right now. So give them a little shrug. Take your head side to side. I want to make sure the neck is staying loose or safe. Okay, so not creating tension. You might just kind of roll it. We can roll to the front of the body. We're not going to roll to the back, right? So we're not going to tip the chin up and roll the head back. We can roll it forward, and we can take it to one side, and we can roll it forward again and back to the other side. We come back to center, and we're going to scoot forward again. You're going to grab your ball, okay, or whatever you've got to squeeze between the thighs. So you're going to grab that ball. So I want you to now, we're going to connect this adduction, meaning you're adding your legs back in, right? So these muscles along the inside, inner thigh, are going to work, but they're also supporting and connecting and helping you lift up through this pelvic belly space again, right? All of this connects and helps support your back. All right, so shoulders pull back. Your hands can be by your side or holding onto the chair. Make sure your feet are flat. Your knees should be in line, about in line with your hip, right? If not, bring something to put under your feet to lift them up a little bit. Okay, so we're going to inhale. Exhale, I want you to squeeze the ball as hard as you can and hold it and see if you can, like you're zipping up from your pelvic belly, from your pubic bone to your belly button. Now release. Inhale. Exhale, squeeze, blow out the air. Release. Inhale. Prepare, and now exhale, blow it out, squeeze. You might even feel shaking. It's okay. Inhale. Again, if you need support behind your back, place something back there that's going to give you a little support. Blow it out. Inhale. Exhale, squeeze. Okay, so don't stay in a position that's not working for you. Keep going and breathing while I'm talking. So if you're like, this isn't working quite right for me, scoot back. It's okay. All right? Scoot back. Just make sure that you keep that little space behind your back. All right, let's take 3 more. Shaking probably has started by now. right? So those inner thighs are really working. Squeeze them together, blow all the air out, zip up. If it's hard to make all of those connections happen at one time, keep practicing. Exhale. All right, let's take 2 more. Inhale. Exhale. And you're taking 1 more. Exhale. Squeeze the ball. And release. All right, very nice. So working there for the inner thighs. So at any point, if you need to just take a little break, take a break, pause the video, come back. You might take a little rounding again. Okay, just kind of move around. So you never want to feel like you're getting stiff or strained. All right, so we are working muscles, but we're not trying to strain our back in the process. So let's take that band that you've got. You're going to wrap it around your thighs. Let's bring the feet about hip distance. So there's going to be a little space again right here. It's about the size, maybe say while we're seated, we'll say it's about the size of a fist or so. So take that band, let's tighten it up a little bit so that there's enough tension on it. Okay, you might even bring the legs closer together to tighten it. Depends on how tight your band is, so what strength your band is. If it's so you'll know when you get started, we don't want to strain, but we do want to have resistance. Okay, so now again, you might be holding on. I probably wouldn't sit all the way back in the chair for this one. It's just a little harder to move your legs, but again, judge that for yourself. Find what works. Inhale, exhale, and now open the legs. Okay. Inhale, bring it to center. Exhale, take them apart. Inhale. So again, we're always engaging, zipping up into this pelvic belly space. Shoulders are staying back. Exhale. Inhale together. Exhale, open. So we'll take about 4 more like this. I'm going to show you one more little trick that we can do for those abductors. So we think about it, what's happening, we're taking the leg away. So anytime we're taking something like away from the body, we have abduction, like you abducted it away. And then when we bring it in, we're adding it back in, adduction. So let's take one more. So primarily our abductors are going to be the muscles that are closer to the outsides of our body, right? Because they help lift and move away. So if you anchor your feet, take a deep breath here. Again, get strong in your core. Support yourself if you need it back here until you get strong enough to sit tall without the support. Okay, we're going to take the left leg and just open it out to the side and bring it back in. So inhale. We're going to try to notice I'm keeping my shoulders steady and I'm trying not to turn my body with it. I'm going to anchor this leg and use that as my anchor to resistance that's moving out to the side. Okay, so let's take 4 more. 4, engage through the core. All these muscles are pulling in, holding you like a girdle. We've got 2 more, out and in, and 1 more, out and in. So now take the opposite leg, take it out and in. Inhale. Exhale. So find the breath that's right for you. It's not crucial that you inhale on one movement and exhale the other. So if you're taking your leg out and you inhale, leg in and you exhale, or vice versa, it's okay. Right now, just take what works, but make sure you're engaging and breathing. Okay, never hold the breath. Last 4, out and in. Out. That band should be right about mid-thigh, maybe a little closer to the knees than to the hips. Last 2, out, in, sit tall. Last 1, and back in. All right, very nice. You're going to release that band or strap, so you could probably just slide it off at this point. Okay, so you're going to come to standing. You might just stand behind your chair. I'm going to turn my chair so that you can see what I'm doing. All right, so As you come to standing behind your chair, you're just basically a 4 arms length away. All right, so if you bend your elbows, place your hands on your chair, that would be about the right space. So you're going to take your left leg and send it back. Okay, not very far. Notice I'm not tipping my chest forward and my hips back, or my hips forward. So I'm just going to stay nice and lifted, and I'm just going to gently place that leg behind me. So from here, I want you to find your hips. Find your hips in the front of your body. You're going to pull them up, right? So it feels now like you should feel this muscle back here that fired off a little more, right? Your glute muscle, your bottom, and this muscle back here in the back of your leg, your hamstrings. Okay, these 2 muscles help to pull your leg back. What we're doing is we're working also with the pelvic space again, your belly, and all these muscles around the center to stabilize. These work together, okay, and they're what help support your back. So shoulders back and down. You can always put a little bend in this standing leg that you're holding yourself up with. We're just going to take a tiny little lift and then a release. So I don't want that to hurt your back. If you find that that bothers your back, soften your standing knee a little more. Pull up through the belly space and maybe just pick the foot up and lower it down. You got to be careful that you don't get a cramp in the back of your leg. All right, so again, you might take a slight lift of your heart and then lift, squeeze, pull up, release. It's just a little hip extension lifting. All I want you to do is squeeze. Okay, we're not doing a lot of these because they're very effective and the standing leg starts to burn, right? So this other hip may start burning a little bit. We're going to work up to more of these later. Okay, so just a couple more. Lift and lower. I don't want you to overarch or overdo it. Maybe you soften that knee a little. Okay. And let's release. You're going to switch sides. You might move this out a little bit first. Take the other leg back. Inhale. Exhale, lift. So again, I want you to zip up in your pelvic belly space. Find that space in the back of your leg. You're just floating the leg up and releasing. All I'm doing is contracting the glute muscle here. Okay. Just contract and release. Breathe. What you'll notice is that I'm not doing this, right? And I'm not overarching in that back. That hurts. Don't do that. Okay, just float it, release it. Float, stabilize. Let's take 3, 2, and 1. I want you to feel like your tail is long on all of these. What does that mean? Release it. It means that while you're doing them, you're always going to feel like you're creating a little bit more of that cat tilt. What was that when we were seated in the chair? Remember your cat? Okay. So while we're standing here, let's take a moment and let's just kind of release this out a little bit while we get a little more work for our legs. Okay, so we'll inhale. I want you just to softly bend your knees and start to send your hips back. I'm not going to bring my knees out over my toes. I'm sending my hips back like I'm hovering over a stool that's behind me. Okay, so I'm just pulling the belly in. I'm rounding just slightly in this low back space, not in the upper back. Okay. All right, so just kind of tuck your tail just a little bit and then release it. Just tuck it a little bit and release. And let's take one more little bit of a cat tilt. Like you're stretching like that cat stretch in your low back. Just a little, and bring it back up. So now you come back to seated. As we come to seated, sitting tall, we're going to bring the shoulders back and down again. Let's go ahead and take the feet together, knees together. As you slide your left hand across toward the opposite knee, start to slide your right hand back. You can hold on to the side of your chair. Okay, so notice my knees aren't going to come apart. I'm going to keep them together. Sit tall. Now I'm going to start to turn my chest. Rotate your chest. So now my sternum, the center of my chest, is facing to the right side of the room. The right hand might just be holding on to the side of your chair. If you want to walk it further back, that is your choice. Just make sure you're careful not to try to force anything. We'll come back to center again. Inhale. Squeeze knees together. Start to turn the chest. The right hand slips across. Deep breath in. Again, notice you're pulling your left shoulder back. You're pulling forward with your right shoulder just a little bit, or so more your side of your waist, kind of pulling forward or around. Let's take one more breath. Come back to center. All right, so your next option, depending on how your knees feel, but we want to open those hips back up a little bit. We did a lot of work for the hips and the thighs, and in that low back space might have gotten a little bit cranky or tight if you're just beginning this kind of a program. All right, so we want to take the left leg. You have two options. I'm going to give them both to you. So you can bring this knee out and bring your ankle on top and just come forward gently over your right leg. Your next option, if the knee and your hip allow, we can bring this leg up and cross it over on top. You're going to flex that foot, hands beside you, inhale. Now just come forward with your heart. So I want you to be very mindful here that you're not rounding. This is what we're trying to correct in as far as our posture, right? So we don't want to round when we come forward. We're going to lift your heart up and then move forward. Notice you can still see my nose, right? So I'm not hanging here. So I'm just coming forward. Let's come back, inhale. Exhale, come forward. Let's take one more. Inhale. Always breathing. Exhale, come forward. Take a moment there. You might even just rest your hands or rest your forearms right here across your shin or calf. Let's take another 2 breaths. Deep breath in. Exhale it out. One more. Come back up. Switch sides. So again, you know where you're going. You could stay here. Do all of what I'm doing with this ankle crossed over or up top. Okay, whichever version is right for you. We're not forcing the knee down. We're just pulling the toes back, okay, so that your foot is flexed. So inhale, lift tall. Exhale, move forward with your heart. Okay, so I want you to try to pull those shoulders back. Inhale. Notice your chin slightly down, your ears in line with your shoulders. Okay. So if you think about it, it's kind of like the space between your chin and chest is about the space of your fist. If you put your fist here and try to hold it. Let's take 2 more. You're still moving forward and back. Probably feeling quite a stretch in that outside hip. Maybe the inner thigh too. Let's pause. So again, hold on to the chair or arms can come forward. You can exhale through the mouth or through your nose. Make sure that your chin doesn't start to drift up or that your forehead starts to kind of drift down. So we're just staying neutral, and we'll take 2 more breaths. One more. Let's release that top leg. I want you to sit back in your seat. Just do a few rolls of your ankles one way and then the other. Okay, just shake them around. Release and just roll the shoulders back. Let's take one more big heart open. Inhale. And then exhale. Bring it back to center. So you are done today for the seated portion of your workouts. Take a little time, do some floor work later or maybe before this. If you do them both every day or at least every other day, I think that this will help you quite a bit and will get more mobility and get you maybe even a little more strengthened in some of these lower body muscles, so that will help to support your back but also help you just move easier. And then that upper body, we can get that upper back supporting your front of your chest, okay? so the front body, so that we can kind of start to eliminate this rounding. All right, so come back often. Let's do this again.